Good morning, Arkansas. Interventional cardiologist Yazan Ghosheh from CHI St. Vincent is here this morning to tell us more about PAD, Peripheral Artery Disease. Of course, February is Heart Month, and you are specializing in endovascular. You're an endovascular specialist, correct?
Correct, yes. So thank you for having me. Yeah. We're going to learn a lot about peripheral artery disease.
Yeah, so what is PAD and how serious is it? I, for one, am learning a lot about the heart this month, so explain to me what that is.
Good. So peripheral artery disease is blockages that happen in the branches that take off of the aorta.
Yeah.
Basically, the aorta is your main highway. It splits into two arteries that go to the legs. And when a waxy substance we call plaque builds up in these arteries, it causes narrowing.
Yeah.
So the muscle and the tissue are starving for important nutrients like oxygen and other nutrients. And that's what happens when this plaque builds up.
How does plaque build up? How does that occur?
Good. So it's part of a wide spectrum disease called atherosclerosis. It affects the heart, it affects the arteries that goes to the head, affects the aorta. It affects everywhere. And it's basically a lot of risk factors are involved.
Yeah.
Number one is age. Number two.
So it can develop as you age.
Exactly. Our risk for atherosclerosis increases as we age. Second is our unhealthy life habits.
Yeah.
Smoking.
Diet.
Sedentary lifestyle.
Yeah.
And then other modifiable risk factors like uncontrolled diabetes, uncontrolled hypertension, high cholesterol.
Yeah. How do you tell if you had it? Are there big signifiers that you would go, oh, you have PAD?
Good. So the most difficult part about peripheral artery disease is that it's a very common disease, but it's vastly underdiagnosed and undertreated. Yeah. The reason is 50% of people with peripheral artery disease are asymptomatic, and they only get diagnosed when they're in the advanced stage of the disease.
Okay.
So one advice I give all my patients is whenever you go to your primary care follow-up, you take off your shoes, take off your socks, because there could be some signs that we can, or even you develop symptoms like, you know, changing the color of the skin, loss of hair, decreased pulses.
Yeah.
So if we can catch the disease early on, we can treat it more appropriately.
Yeah, so, okay, how would someone know they had PAD versus leg pain for some other reason? You just mentioned taking off shoes and socks.
Right.
Does it show up in the legs?
Right. So, as you said, there's a lot of diseases that mimic peripheral artery disease.
Yeah.
It always depends on where the patient falls in risk factors. For example, as I said, as to age, about 1 in 6 or 1 to 8 Americans above the age of 60 are at risk for peripheral artery disease. So, first of all, the patient profile, the risk factors, and high index of suspicion. The test that we can confirm, or at least get a sense, is a very simple, non-invasive test.
Yeah.
So if we have diabetic patients with atypical leg symptoms, the test is very non-invasive, very simple, and it will provide us a lot of information.
Yeah. So what kind of treatment options do you offer?
Good. So the first thing is change our risk factors, control our risk factors. If you have uncontrolled diabetes, we're going to push to control your diabetes. Second, if you're smoking, we're going to provide everything we can to help you stop smoking. And then once we confirm the diagnosis of peripheral artery disease, we go in stages depending on what level of disease the patient presents in. If the patient presents at the far spectrum with ulcers or gangrenes in their feet, then we become more aggressive in going forward with an intervention on the leg to save the limb. If someone still has symptoms that are mild, for example, if they walk, their calves hurt, if they stop, it goes away, then we have room to start medications, cholesterol medications.
So your treatment options depend on how far along someone is.
Exactly. Almost everyone needs a cholesterol medication and aspirin and needing to stop smoking.
Okay. Well, so what can happen if something like this is left untreated?
Studies show us that about 5% of people annually will progress from one stage of the disease, mild to moderate to severe to gangrene.
Just in a year?
Annually, 5% of people annually, yes. So what do we do about it? It doesn't mean that everyone needs to go to the cath lab to get their legs fixed. What it means is we need to be more aggressive in risk factor modification. Someone who has peripheral artery disease, immediately we aim for lower lipid levels, cholesterol levels. We are more aggressive in encouraging them to stop smoking and keep them monitoring so we can before the toe gets an ulcer or gangrene, we treat it beforehand.
Yeah, so you want to be preventative. You want to
Exactly.
lower your risk as you develop symptoms.
Exactly.
Well, all right. So for people who want more information, treatment options, and just want to know more about it, where can they go?
Right. So we're located in St. Vincent, part of CHI. In St. Vincent North, we have a very advanced cath lab in peripheral interventions.
Yeah.
Very state-of-the-art technology there. They can visit our website at CHI St. Vincent/heart, which was established because of the Heart Month.
Yes.
They can calculate their heart age. And yeah, that's it.
All right. And I believe you guys have a Facebook and Twitter as well, correct?
Yes, sir. Yes. Yes. Facebook
All right.
and
Well, Doctor, thank you this morning for this wonderful information. He's Dr. Yazan Ghosheh, everyone. He's CHI, giving us some great information on PAD this morning.